I want to talk about nursing today. So I started a new job, and you want to be respectful and cordial and not have a bad start on a new job. But what do you do when there's someone there that just wants to cause havoc with everyone that comes into this position? And she actually raises her voice and talks to you like you're nothing. I mean, not a coworker, not a peer. She raises her voice and talks to you like you're nothing. And she's on the same level as you. Things just ain't the same. We gotta talk. So, in this period of my start on this new job, I have had to address this person 4 separate times on different occasions of raising her voice. Now, I'm to the point where I'm not going to address it anymore. And it's going to be pretty hard to accept the next time. So thankfully, a supervisor did overhear my last discussion I had with this person. And she took her and the doctor in the room and had a conversation with them. And now you can even hear a penny drop, a mouse run across the floor, or a needle fall on the floor. It's just that quiet now. But I am not going to be disrespected. So I am not going to be disrespected, as I was saying. Thankfully, this person did address them. Right now, things are pretty quiet, but as a nurse, we swallow so much. We tolerate so much. So why do we have to tolerate it from each other? It's bad enough. It's illnesses out there. People are sick. When they're sick, sometimes they will talk to you any kind of way. And you have to kind of, okay, they're sick. That's why they're talking that way. But not all the time. But don't do that to your peers. Don't do that to your fellow nurse. No. Things just ain't the same. Because I'm not tolerating it. And that's why I am a business owner now. And I will not tolerate this amongst my employees once I get everything situated with my business. Nursing is a job from the heart. Nursing is a job of compassion, understanding, a job of sympathy and empathy. And if you don't have it, sweetheart, you should not indulge. Because patience is a virtue, and patience does come with nursing. You can't expect to train someone 2 days and then give them a paper and say, here's your training. And please don't ask me any more questions. Who does that? I've trained plenty of nurses, new coming nurses, even as a registry person, and not once did I ever step to them in that manner. It's impossible. We are dealing with people's lives here working in this field. And you really have to change your mindset, have to change the way you respect each other and hold each other up, because that's what it's all about now. Things are rough. We are going through a hard time. Everybody's getting sick. Things are pretty tough nowadays in the nursing field, medical field, period. If you're having a problem or an issue, trouble with yourself, you got ADD, whatever the issue is with you, that's understandable. But don't bring it to work and don't lash out on other people. I'm not the one that's gonna take it. I'm not the one that's gonna allow it and tolerate it. Things just ain't the same. Now, being where I'm from, not that it matters, I could get ignorant just like you can. I can get disrespectful and I can get loud and raise my voice. But I don't need to go there to prove a point. But you will not talk to me. I don't know where you came from, what people you're used to dealing with, but no. And then come to find out the last 3 sisters that were in place prior to me all got ran up out of there. And I whether I stay or go is not acceptable. Not at all. Because you know what? Things just ain't the same. If you're a nurse, let me know what you think. Now for me, this is like a venting session, but also nursing chronicles, and it might even help another nurse out there that's going through the same thing. Because these are difficult times. I mean, money is tight for everybody. People are trying their best to survive. Yeah, nurses might make some pretty good money, so to speak. But things are expensive now. And it doesn't matter how much you make. You still should not have to go to work and have a headache every day. Feel like you're going to be reprimanded by your coworker that's the same level as you. You know, who does that? What kind of people actually go to work and raise their voice at people when you ask them a simple question? No. As I was saying, once I get my business established, my employees will not go through any type of BS like this, and I will see to it that it's taken care of and make sure that I'm hiring the right people that have the right heart for nursing. You know, of course, everyone can put on the front and appear to be something that they're really not. But if it comes down to that, then you can go find, something else to do or go elsewhere and find your employment. Because this is not acceptable in this type of field. Ugh, who does this? And, I just need to talk to people. And so, for me, I'm an old-fashioned nurse, and I know nursing is not the way it used to be. But you still have to have a heart that's in it. You still have to be caring. You still have to have empathy. You still have to have that bedside manner, whether you're in a clinic or wherever you are. So the bottom line is, I know everybody's not going to like you. Not everyone's going to appreciate your kindness and your niceness. And not everyone's going to be kind-hearted and nice like you are. But we got to do something about this toxicity in the nursing environment. It's just, people are stressed. I get it. We are all stressed. We are all short patient nowadays, but there has to be some type of unity in the nursing community. And I'm not the one to tolerate the toxicity and the unfair treatment. So I would like to know if we can all come together, if I can start trying to pull people together. No, we're not all Florence Nightingale. Although we do follow her footsteps, or most of us followed in her footsteps. That's why we became nurses. But I would like to pass around the crown to all my nursing sisters and brothers out there and hold all of you up and continue to hold everyone up. And I hope you all will take part in this and start holding one another up too. in the nursing community. Because, guys, we got to stick together. It's rough out there. Thank you very much for listening. Thank you very much for your time. Because, again, like I said, things just ain't the same. Things just ain't the same. Tanya B. signing off.